Hello everyone, I'm really happy to be here and I thank the organization for inviting me and give me the opportunity to share with all of you our experience in Italy about the management of Tofersen and the challenges we have in our country. And I start with the role of the Italian ALS Association that is working just for be the connection from clinician and patients and for giving for all patients and their families all information and the possibilities they could have for have access to this therapy. But what we are talking about, SOD1, you know, is a little part of the genetic cause in ALS, and the disease mechanism in genetic we have two main problems. Or one, when there is a mutation in a gene, you have a loss of function, or you have a gain of function. In this case, we have a gain of function. What does it mean? That the protein start to work in a wrong way, and Tofersen has the goal to reduce the synthesis of this protein, and in this way, people start or would be starting to stabilize his clinics or maybe improve his functions. In Italy, we have estimated that we have almost 120 people with this mutation, and the most part of them have access to this therapy, and almost enough of these patients we are managing in our unit. The name is Nemo Center. Do you remember of course, the movie from Disney about the little Nemo? And we just catch up this idea because of the little wing dystrophic, and this is the symbol of our center, but also it means neuromuscular omni-center. And this is a really good network also for families and patients, and we are, I think, doing a very good job. But what the Italian ALS Association did, it just spread out and sent out an email with a survey just for understanding how the patients are, they are feeling about the successful of this treatment, or if they have challenges in getting access to this type of therapy. And what the results is not very good, because anyway we have a lot of region in our country that have challenges in getting the access on this treatment. Maybe there are some reasons we have thought about, and maybe I want also to highlight to you that in Italy, genetic testing is free of charge for patients. So maybe one problem for getting the genetic test is maybe due to genetic test is done just in few centers in Italy. So maybe we have to do more just for increase the number of the possibility to people to have access to this testing, because without test you can't also have the access to the treatment. So just for talking more with the government and stress how much is important and how much this is the impact of this new treatment with to our community. We have published recently a paper and in which we described our experience in management for almost 2 years of a number of people, I think almost 20. And what our findings are really promising. And I think this is the real good part of our job. We found that there is a reduction in CSF and the serum of the NFL concentrations, and this is strongly suggests that Tofersen could affect the progression of disease. And this is a really big point for everyone. Maybe not in all of our group of patients, and this is we really don't know it right now, but maybe we have also to improve our learning about this type of disease. Now I think it's why we are here all together. I mean, I understood a lot in these days when I came just Saturday. And I think the alliance has been created just to keep all of us together, and especially I think just for making people and their family don't feel alone, but with a hope. And I think ISLA is with this feeling is working very well just for reduce the delay and the inequalities in our country to have the access for patients to this treatment. And I think like clinician, we have not to lose time, because now we have a really promising treatment, and altogether I think we have to push the government, I think, not only in Italy, I think, just for have the opportunity for everyone to have access to this treatment, and above all to don't lose the most powerful, I think, therapy that we have already have, that is hope for our patients and their family. I'm going to conclude my presentation for giving a lot of thanks, especially with the first goes to my group that allowed me to be here with all of you, and also to the Italian ALS Association that is doing really a great job for all patients, and the last but not least for all my patients and their families that they are all with me today, and I give you a really big hug. And thank you all for listening to me, and I'm pretty open for questions if you have.
Thank you so much, Riccardo. Are there any questions from the audience or from online to start? I hear a hi. Marcella? She broke it. I can start with one then while you guys get that working. Do you have the timing of the genetic test and getting the Tofersen to match up with all those patients too that you showed?
Do you mean when do you have the access, and when do you have the result?
Like when they were diagnosed, and then how soon after that diagnosis?
I think we are pretty good in that. I think in almost 6 months, you have from the diagnosis to go through the genetic test. Do you have access to the treatment?
Okay, now it's working.
Hi.
Marcela from Acela, Colombia. Thank you, Ricardo, for your presentation. I get a question a lot from my patients, and I don't know how to answer it. I don't know if you maybe can help me. Why does Tofersen work only for SOD1 patients and not for the rest of the ALS patients?
I think it's
in a way everybody can understand, not just doctors.
Yeah. I think it's pretty easy on our hand, and it's difficult because sometimes for our doctors, I think there is a problem of communication as well. I think SOD1, if you don't have any mutation, it works. So if you don't have any mutation, and so if you are SOD1 negative, it means that everything is fine. So I don't know if you catch my answer. Do you understand me? No.
You need a microphone so the online people can hear.
This is a problem.
I'm one of these pesky genetic carrying families. So what he's saying is if the SOD1 in your body is working, they can't give you a treatment to make it work better. So if you have any other kind of ALS, this treatment is not going to help because it only fixes your SOD1 problem.
Thank you. It's why we are working in a multidisciplinary way, because there is. Thank you very much.
Are you, I'm sorry, I should look if there's other questions. Nope, no questions. Are you looking at function as well? Function, strength?
Okay. Do you mean after the treatment? Okay. Again, I'm a PMR. I didn't have a good presentation of myself, but I think this is a key point also for physiotherapists and all the rehabilitation healthcare system, because even though we have a therapy, it's not enough. You have, and Liane, it's a perfect example, I think. If you just give the patients the therapy, you have started to really care the patients. But you have also to introduce all the rehabilitation stuff the patients need. And what we have found that it helps a lot. It helps to increase function, and maybe I think the real goal after this type of therapies is just stabilize the clinic. So I think this is a really good point to increase, I think.
Thank you. Are there any other questions? Anything online? Everyone just wants to have a break? All right, then we can say thank you very much.
Thank you.